Hi there, it's Bonnie Adam from pathwayshealing.com, and if you've been watching social media with my sites lately, you've noticed I've been trying to create a little bit of hype or just like tease everybody about my new toy that I bought. And toy, by toy I mean, here's the big reveal, my new laser acupuncture device. Now, I have used laser acupuncture for years, and I did have training in my original acupuncture course that I took a long time ago. And I've been using this device actually for quite some time. This is called the Pointer Plus device, and it has a little bit of it just has a single bulb laser on it, and you're not supposed to look at those in your eye, so I don't want to point it at you. And that was quite effective. I used it a lot for children or people that were a little bit too nervous about needles. I would use the laser for them. The one thing about that little device, it's a great little device, but with only one light bulb in it, or one laser bulb, it was very time consuming, and you can only use one bulb. This guy has 14 little bulbs in it, so you get quite a lot more coverage with it. It's a stronger laser. It goes deeper into the tissues as well. So, and it is a cold laser, so it's not going to burn anybody or cause radiation or anything like that. Nothing like what you would use to get a tattoo removed or even hair removal, that kind of stuff. This is a soft laser or a cold laser or a low-level laser therapy device, if you want to look it up. One of the reasons I started looking into getting a laser device was because lately, since I'm in my own beautiful space again, I've been using a lot more Moxibustion in my practice. And before, when I was in a multifaceted clinic, they're not really usually big fans of Moxa because it's very smelly and smoky, and people come in and it has a very pungent kind of odor too. So people wonder, what the smoke is or what you've been smoking in the building. So, it kind of has that reputation as being very smelly. And it's also a little bit of a hassle. There are people that are really good at it, and, they're really efficient with working with Moxa. But I do find it it's a little bit difficult to light the Moxa, keep the Moxa going, make sure you have, a safe environment for the Moxa, because it is a herb that is lit on fire. So, that can be a little scary for some people too. And there's ashes and that kind of thing. It gets on your linens, and, it's a bit of a mess. So lots of cleanup and that kind of thing. So it's a bit less convenient to do Moxibustion, even though I really love the results. And I love how it helps people. It's really good for relaxing tight muscles and for warming people. We use Moxibustion a lot with acupuncture when we have people who have what we call cold or stagnation. And cold is kind of just what it sounds like. The people that are always cold and easily chilled, and, they have a hard time getting their circulation going. They have poor circulation. They often have lots of aches and pains and that kind of thing, and inflammation. And Moxibustion is great for them. And as I started using Moxibustion a little bit more lately, I've started thinking, how is this working? Why is this working? I know way back in school you had your theories, but I'm 10 years in now, and I'm like, well, what's actually happening? I want to know more scientifically what's happening there. So I started doing some research over the holidays, and looking at some studies, and some of the studies actually showed that they believe that the component of the Moxibustion that is doing the work and helping people is the infrared heat that happens on the end of the Moxibustion when you're burning it, because you get that red ember. There's some infrared there, and that the heat is also one of the advantages as well, so to warm people up. And we often do Moxibustion right on a needle or around a needle, so the needle is into the muscle, and then you warm the needle, and that sends the heat down the shaft of the needle. So things like that, I've started looking into a lot of studies. And I listed a few of those on my website too, if you're curious. I have a resources page on pathwayshealing.com, so you can look at those if you like. I'm looking at my list. So I started looking at, what's happening here, and can I do this in a more convenient way, really? Because, I want to help people feel better, and I'm always looking for ways to do that, but I'd also like it to be simple and easy and not smelly. And I've already had people in the new building coming by and going, are you burning something? What's burning? Is something on fire? So, you know, there's a little bit of that. And also, you know, sometimes people are a little nervous when you're using something that is hot and smoky next to their skin. So looking for the easiest way to do stuff. And then I found some studies too comparing Moxibustion to low-level laser therapy. And it turns out, you know, they're pretty much the same, and laser therapy is probably a little bit better even. So I'm like, okay, I've looked at laser devices before, especially when I was, you know, going to buy this little guy. And they have become a little more affordable and easier to get the last few years. So then I started looking for lasers, and I got my laser when I'm so excited to start working with it. I've been using it on my knees and my hip that I have problems with, and already after just a few days I'm feeling a difference. So I'm really happy to be able to bring that to people. The thing that the laser can help with are things like pain, definitely pain, inflammation, arthritis, osteoarthritis, muscular tightness, trigger points, anywhere you've got tight muscles, and things like PMS too, like, you know, and those cold people, right? You've got aches and pains and you know, poor circulation, and you just want things to feel better. And also can help with addictions and trying to quit smoking, that kind of thing. So we do laser points in the ear for that. You know, so lots of uses for the laser. And how I see the laser integrating into my practice is that, you know, at any appointment, if you've ever come to see me, you know that we may be using acupuncture, we may be using cupping therapy, we may be using gua sha or the scraping tools, we may be adding electrical stimulation to the needles. And so the laser is the same kind of thing. Is that maybe something that, depending on what's happening with you, I might suggest, hey, do you want to try the laser? See if we can get this to give. Right? So I've also decided, well, there's got to be more ways to work with this tool. So one of the things about laser therapy is that you might want to do it more frequently. So a lot of people come and see me maybe once a week, once every couple of weeks, once a month. If you really want the laser to help, I would suggest trying to book 2 to 3 appointments a week for a couple of weeks, and really get that, you know, get in there and get things moving and get the cell regeneration happening so that you can heal the injury. So that's what I'm suggesting for that. And I do have a new service that I created on my Jane app, which is bonnieadam.janeapp.com. So Jane, just like a woman's name, and then APP. And that I have a 30-minute appointment in there. So you're going to be in and out really fast, actually on the table about 20 minutes. If you're booking that, I call it the brief acupuncture appointment, we're really only going to work on one spot. So like say you have a sore shoulder or a bad knee or an elbow injury or carpal tunnel or something like that. So it'll just be a one spot treatment. And I ask you to wear like stretchy clothes so you can just roll up your pants or roll up your sleeves. Or if it's a neck thing, wear a tank top so we can get at the injury quickly and you're in and out fast, and it's a little bit more affordable for you that way. And then I can still fit everybody into my schedule. So I am going to show a little video I'm going to tack on the end here of some different kinds of Moxibustion, because I will still offer that as well. It's still a really cool thing to try, and it's a little more traditional, and there's an energy component to it as well, where we use the herb mugwort, and when we burn the herbs, it brings the energy of the herbs into the treatment as well. So some people will still really like to try that. So I think that's about everything I wanted to tell you. If you really are interested in doing a laser therapy, if I have not seen you previously, you will need to book the initial consultation first before you start booking those brief appointments. But if you've already been to see me and you want to try laser, you can slot yourself in or give me a buzz, and we will see how that works for you. Looking for lots of people to come and try this out. So it's January of 2021 as I'm making this video, so I want to wish everybody a very happy new year, and I hope to see you soon. Okay, so these are some of the different kinds of Moxa or Moxibustion that we can use in clinic. Got a little candle there, and this is one of the main ones that you'll see is the loose Moxa, which is inside this little paper tube. And what you do there is you light it. And you can see it takes a while even to get the loose moxa to, you know, to catch on. But you can, there's a little bit, you can see it's starting to go. And you can buy like really fancy lighters that are a little bit faster, but I find they use a lot of butane, and then I have butane gas in my clinic. And you see this is just starting to go, and it's super smoky. So, you know, and they feel wonderful. They're really nice to use, but it's the smoke. That's the biggest problem I've had. And I'm just, I keep a little cup of water around just to douse it, because I've also had, when you lay it down on the tray, I have a stone table now, which is a good thing, but if you don't have like a fireproof surface, I've had it heat the metal right through the tray and burn the desk underneath. So not so great. Now this is another version, which is just like a little, it's a charcoaled stick, same material as the stuff in the paper wrap, but it's been turned into like a charcoal. And you do the same thing, you light that. And I'm not going to light this because this takes like forever to get it going. And then when I finally get it going, it doesn't smell too bad. It doesn't leave much of a smell. But it's still quite, you know, once you finally get it going, then you can't get it to go out kind of thing. So the same thing, you would take this and I would like usually circle it around one of the acupuncture needles or bring it close to the skin and just move it, almost like a little tiny blow dryer is what I say, to warm the skin and warm the needle. And then the warmth can travel right along the needle into the muscle. You can use things like these, which are, sorry, that looks huge in this screen. And then you would put your stick inside. And then underneath it has like a little screen. So it's, you know, and then you can put that right on a person's body. They have little boxes, they have all kinds of stuff. You could put the paper one in there too. And the beauty of this one is because the little screen in the bottom, it catches all the ash. So you don't have to be quite so worried about ashes falling on your patient while you're working on them. And I find with the sticks, like we have these little guys here, and you have to keep going back and like scraping off the ashes every few minutes to make sure that you don't get any ashes on your patient when you're using the Moxibustion, any hot ash. And then there's some of the more direct versions. This one here is actually, it's a slice of ginger. And then you take like a little incense stick, little smokeless incense, and a little ember going on the end there. And then you just touch it. And that starts to, you know, you place that directly on someone's skin, like right on their body, and then you let that burn down. And then you would take like the next little ball and put it on top, and another little blob and put it on top, and another little, and they call it rice grain moxa in some places. So that's another way you can use. Just put that down so it doesn't catch anything on fire. You can get pre-made ones, like this little guy is like a pre-made wrapped in paper that you could put either on the slice of ginger. Sometimes they use garlic, different things depending on what's happening with the person. Or let's just imagine this little stick is a needle. You can place it right on a needle and then light it again with your little, you know, ember. And so see, now my little thing's gone out, so I need to go back to the fire again. And you can see why this is a very painstaking process. It's a lovely thing to do. Oh, there, that one's finally starting to go. Or sometimes you could like even take it to the fire, like, you know, or bring a lighter and light it right when it's on a needle inside, like on someone's body. So that's that one. And again, I'm not too worried about burning because I'm on a stone table. There. And we have things like these little slotted spoons. So then when this is done, you take the spoon and then you just pop it off of your needle. And then, you know, so the person doesn't get burned either. This is another version where you have a little metal guy and you can put that right on your needle. And then, again, you can light that, you know, with your stick. Well, and you can see sometimes this happens. I got Moxa stuck on there. Now I have to get rid of that. without letting it fall on anyone and possibly burn them. So these are some of the little things that can happen. You have to be super cautious with Moxibustion. So there are people that are really efficient with their Moxibustion. They're absolute masters. There is really very little chance that someone will get burned. I'm going to, put that out just to make sure that people are not afraid of it. But, it takes some skill and some practice. And again, the disadvantages are the smoke and just the fussiness of dealing with things that won't start on fire, and then they're on fire, and then I don't want them on fire, and I've got to put them out and all that stuff. So that's some of the basic stuff about Moxibustion. Hi there, it's Bonnie Adam again, and I just wanted to show you another kind of Moxibustion that I really have been enjoying. I've just learned about this one recently, actually. These little Moxa heat packs, and I'm not sure if you can find them online, but I do have some for sale in my clinic. They are like the little bean bags that you put in the microwave, but they stay hot for like 12 hours, which is really cool. And you can see they're not too big. I can just hold it in my hand there. You could even put this in your mittens or something. But it's filled with mugwort and activated charcoal and a few things. And to activate it, basically you just open the package and it's oxygen activated. And then it will stay hot. Now, there is a caution to just to be sure that you're not leaving these with in your bed or anybody who is vulnerable or somewhere where it could start a fire, because they do get quite hot. And also not to put them directly on the skin when they're hot. You would put like a layer of cloth around it or wrap it in a tea towel or something. The other thing about them, and this one's getting hot now because I've been handling it, and when you shake it around, the oxygen gets in there and activates it. The nice thing about them too is it's supposed to be a one-time use, but the secret trick is if you put it in a jar and put the lid on, so I've got a jar in the picture, and that will get rid of the oxygen, and then it will shut it down, and then you can reuse it. And this one here I have reused, I think, about a dozen times now. And I just keep putting it back in the jar and cutting it off and then taking it out again and shaking it up. And sometimes it takes a while to get it going again, but it does keep going for quite some time. And I've even put it in the microwave for about 30 seconds to get it going again. And then again, it stays hot for hours. So I really love these for any kind of sore muscles or sore backs or stiff necks or anything like that. So if you're interested in those, I do have them, or you can probably find them online yourself too. They come in a box of 10. So those are really cool and nice for the winter time.